Imagine walking through life convinced that people are out to get you. You analyze every glance, question every compliment, and trust no one, not even your closest family. This isn't overthinking. This is real. This is paranoid personality disorder, one of the most misunderstood and isolating mental health conditions out there. And today, we're unpacking what it truly means to live in a mind that sees danger, even in safety. What is paranoid personality disorder? Paranoid personality disorder, or PPD, is a mental health condition defined by intense distrust and suspicion of others. It's not just being cautious. It's a deep, persistent belief that others are trying to deceive, harm, or exploit you, even when there's no real evidence. People with paranoid personality disorder are constantly on guard. They question motives, doubt sincerity, and struggle to form close relationships. They live in a world where loyalty is rare and betrayal feels inevitable. And it's not because they want to push people away. It's because their internal radar is always scanning for threats. This isn't drama. It's a defense mechanism deeply rooted in fear. Core symptoms of paranoid personality disorder. Let's break down the symptoms. People with paranoid personality disorder may believe others are lying, deceiving, or using them. Interpret innocent comments as attacks or criticism. Hold grudges for a long time, even over small issues. Be unforgiving of mistakes. Suspect that partners or friends are cheating or being disloyal. Be emotionally guarded and avoid confiding in others. Read hidden meanings into casual remarks. Become angry or hostile when they feel disrespected, even if no offense was intended. What makes this so challenging is that people with paranoid personality disorder don't see their thoughts as irrational. To them, these suspicions feel justified. The danger feels real, and that makes treatment incredibly complicated. So what causes paranoid personality disorder? PPD usually begins in early adulthood and tends to be long-lasting. But what causes it? There's no single answer, but it likely comes from a mix of genetics. People with a family history of schizophrenia or delusional disorders may have a higher risk. Environment, childhood trauma, abuse, neglect, or chaotic home environments may lay the foundation. Personality development. If someone grows up in an atmosphere where trust was unsafe or betrayal was common, suspicion can become a survival skill. Over time, this mindset solidifies, and what started as a way to stay safe becomes a prison of fear and isolation. One of the biggest challenges with paranoid personality disorder is that people with it rarely seek help. Why? Because they don't believe they have a problem. They believe the problem is with everyone else. To them, therapy feels like a trap. Mental health professionals may be viewed with suspicion, and being asked to trust the process can feel impossible. That's why diagnosis often happens during a crisis, maybe after a conflict at work, a family breakdown, or legal trouble. A trained mental health provider will look at patterns of behavior, history, and how deeply those paranoid thoughts affect daily life. But make no mistake, PPD is real, and it needs compassion, not judgment. Is there a cure? How is paranoid personality disorder treated? There's no cure for paranoid personality disorder, but there is hope. The key is long-term therapy and patience. Cognitive behavioral therapy can help people recognize distorted thoughts and challenge their suspicions. It's slow, often frustrating work, but progress is possible. The goal isn't to erase the fear overnight. It's to help someone examine their thoughts without becoming them. Medication isn't usually the first line of treatment, but in cases where anxiety, depression, or aggression are present, it can help manage symptoms. Consistency is key, and most of all, a therapist must earn trust, not demand it. So how do you support someone with paranoid personality disorder? If someone you care about lives with PPD, it can be incredibly difficult. You might feel constantly accused, misunderstood, or rejected. You may want to fix things, but feel helpless. Here's what helps. Stay calm. Defensiveness fuels their fear. Don't try to force trust. Let it grow slowly. Avoid sarcasm, secrets, or vague language. They often misinterpret these. Encourage professional help without pressure. And take care of your own mental health too. Loving someone with paranoid personality disorder isn't easy, but understanding them is the first step. Paranoid personality disorder isolates people, both the ones who live with it and the ones who love them. But we need to remember, no one chooses this. No one wants to live in fear. No one wants to push others away. People with paranoid personality disorder aren't bad, they're hurting. Their behavior isn't about drama, it's about defense. And when we lead with curiosity, not judgment, we open the door for healing. If this video helped you understand paranoid personality disorder better, share it. Let someone know they're not alone. Don't forget to like this video and be sure to check out our other videos.